Atika. Welcome, Nosima. All right. Okay, so we have, I think we are good to go. Yvonne. Hi, Yvonne.
Hi.
Good afternoon.
Good afternoon. And
Right.
Okay.
Great. Pleased to have you today. And well, I think almost here, so we still have 2 minutes to go. All right. Yvonne, maybe you want to share a little bit about yourself. I mean, you want to talk to our audience today? Yeah.
Yeah, okay. Hi, good afternoon, everyone.
You can share your screen now.
Yeah, okay. Can see my screen or not?
Not yet.
Okay.
If, wait now. Okay, you try to present. Click the present button.
Okay. Okay, can see my screen now? Okay. Can everyone see my screen?
All right.
Okay, can you see my screen?
Yes, I can. Okay, you try to present. Yeah. So everyone, you can see, right? You can double click if the screen is small. You can double click the presentation slide of Yvonne so that you can make it huge. All right. Great.
Okay, can you see?
Right, Yvonne, the floor is yours. Yeah.
Okay. Good afternoon, everyone. I'm Yvonne. I'm a physiotherapist from YK Natural Physio and Academy, and I in physio field is about 8 years. My previous experience is about treating musculoskeletal stroke and sport injury. So today, thank you for Techcare to invite me to be a speaker to sharing how to treat stroke with hand spasticity. So I hope everyone can see my screen. And now it's 3 o'clock, 5 minutes already, so I can start my sharing today. Okay. What is hand spasticity? Hand spasticity is an abnormal muscle tightness due to disconnection of brain and muscle. And one of the study also say that in US, 2.4 million adults experience spasticity. Up to 40% of the stroke survivors are affected by spasticity, especially in hand. You can see the picture below, got 5 pictures. First, you can see the elbow is in flexor position, wrist is in bend position, forearm is in pronated forearm, the hand is in clenched position, and thumb is in palm position. You can see the 5 pictures below are showing those hand spasticity. And then you can see for certain patients, right, they can show like they have spasticity at the wrist, forearm, elbow, and shoulder. There are 2 types of spasticity. What is the 2 types? And these 2 types, it may occur anytime, but it's usually seen within 1 to 6 weeks after stroke. First is the fraction synergy pattern, like the wrist is in fraction position, elbow in fraction position. For the B is the extension synergy pattern, which is the patient will show in elbow extension position, wrist in extension position, and finger also in extension. Okay. A lot of patients want to know if they get stroke, how long they can get recover. Okay, this graph is showing how many stages and what the stages the patient will go through after stroke. This is from Bernstone stage motor recovery. You can see from the graph they got 6 stages. When the patient gets stroke, they will experience flaccidity, and then after that they will go to synergy some spasticity. That means the spasticity is not immediately happen after the stroke. They get some time, then they will develop the synergy pattern, which is just now the photo I show you. And then after that, time getting longer, they will get the very obviously spasticity, which is just now you all can see from here, the flexion synergy pattern and extension synergy pattern. Okay, a lot of patients come to the stage 3, they maybe will be give up their treatment or they don't want to continue their treatment. If they didn't continue, maybe the spasticity will be permanently. So from here, I want to say different stage stroke, they have different treatment for and a strategy for the stroke. Okay. Why reduce hand spasticity? Reduced hand spasticity can increase range of movement, improve motor control, and help faster functional recovery. And untreated spasticity can potentially lead to contracture, permanently shortening of a muscle or joint due to inactivity. Like just now I show you the graph. A lot of patients, they will stop in stage 3, which is in a spastic position. And maybe year and year, they didn't go to treat it. Then it will become permanently. Now, what is the strategy to reduce spasticity? This is how we can reduce the spasticity, no matter it's physiotherapist, occupational therapist, or patient themselves. For me, they got 3 things is very important for a patient with stroke. First thing, hand positioning. Second, hand stretching. This is the previously when the hand rehab technology didn't come in. Currently, due to the improvement of the science and technology, so hand rehab technology is now coming. So this 3 is very important for a patient to recover from a stroke. Hand positioning is when before the plasticity is happen. Why? When the patient gets stroke, maybe first week or the day after stroke, hand positioning is very important. Correct positioning in early stage can promote body awareness and reduce the happening of the spasticity. At the beginning of the stroke, patient, they didn't show any spasticity, maybe they didn't show any spasticity and flexing. If the patient, the positioning during lying position, you can see from the right hand side of the photo, the patient is lying down on the bed. So how you support the affected hand, which is the stroke side. So you need to put the pillow under the hand, then it will be reduce the happening of the spasticity. And then second photo, you can see a line on the affected side, which is will give more sense of your stroke size and reduce the happening of the spasticity. Okay, from the second photo, you can see a line on the unaffected side. It also can prevent the happening of the spasticity. So you can see hand positioning is very important when the stroke is happening. Okay, this is for those patients who already have stroke for many years or more than 3 months. You can use this as an example for your daily activity. Position against the spasticity movement out. For example, the patient who have the fraction synergy pattern, which is like this, you can see the first photo, it can against the spasticity movement in their lying position. And try to maintain open hand position during resting. And this one you can try to do at home 10 minutes per section and 2 times per day. This is already proved by one of the study. So for those who already experienced stroke for more than 3 months, don't give up. Try to do this at home. It maybe can help your reduce spasticity. Second photo is a sitting position. When you're sitting position, you can put a towel on your finger, and then you press on the bed or the chair while you're in sitting position. It also can do it 10 minutes per section and 2 times per day. And this also will help you to reduce the spasticity on your hand. Okay. Then third photo is the sitting position. Sitting position support the affected side, which is the stroke side. Don't let the shoulder hang in the air. When you hang in the air, the shoulder is easier to be subluxed, and the patient also easier to get experience of the shoulder pain. Okay, this is a hand positioning during the spasticity. Number second, just now I said one is hand positioning, second is hand stretching. Hand stretching, what is hand stretching? For those patients, they experience stroke, their finger is very tight. Wrist also is very tight. How tight they are, but how to treat it? Okay, this is using hand stretching. Okay, there are a lot of hand stretching method you can use for patient or use yourself. But for my experience, I pick up the Physio stretching, which is very important for patient, and they also can do at home. So I present today. So first is the passive stretching. Okay. Second is a prolonged stretching. Third is the active stretching, which is also known as a strengthening. Okay, how is the passive stretching do? You can see from the video, passive stretching is a manual assisted stretching on the targeted movement. For example, you can see the video, the finger is in flexion position. So patient himself can passively and assisted the stroke side and open the finger. This is the passive stretching can do by the patient themselves. Second is a prolonged stretching. How to do prolonged stretching? Prolonged stretching got a lot of method. For example, you can use your good hand and then stretch it in a long duration, but this is very hard. So I advise and suggestion use a spring or hand brace or wrist brace, which is in the opposite spasticity movement and then do in the spring. This can reduce the spasticity also. Third is the active stretching, or also known as a strengthening, which is active contracting one muscle to stretch opposite muscle. That means your finger is very tight in the flexion position. So you can strengthening your extension of your finger. At the same time, you strengthen your extension finger muscle, is also stretching your flexor finger muscle. This three is very important. Okay, this is the few type of the hand stretching, which is patient can do themselves at home. First is the wrist extension, you can see. And then suggestion, do 10 minutes per section, 2 times per day. Second photo is the thumb stretching, which is you need to stretch your thumb by using your good side. Okay, you also can do 10 minutes per section, 2 times per day. And then each stretch you need to hold for 30 seconds at least. Third is the forearm muscle. Okay, forearm muscle. Those patients, they have spasticity, maybe they have a pronation too tight, so they can supinate it and stretch the muscle. And also can do it 10 minutes per section, 2 times per day, with each stretch holds for 30 seconds. Fourth is the bicep. They have a very spasticity and tight on the bicep. Patient also can put your hand at the table with supported table, then you can stretch your bicep independently without any help from other people. So these 4 exercises for stroke patient is very helpful. especially for those who have experienced the hand spasticity. These 4 can prescribe as a home exercise for those patients who have the hand spasticity. Number 2, like just now I said, hand stretching for prolonged stretching. You can use Handsplint and orthotic to prevent the deformity and reduce the muscle tone. And this is different for the passive stretch. Passive stretch is used 10 times per section, 2 times per day. But for hand stretching, for prolonged stretching, you need to suggest for 2 to 3 hours with the spring. Okay, this is also proven by one of the study from 2016. So for those patients who wear spring you cannot wait for many hours per day. It's suggested is wearing to 2 to 3 hours. This is already enough to helping reduce the plasticity, and you can plan another exercise or others functional movement training after the 2 hours spring. Okay, this is hand prolonged stretching. Okay, number 3 is hand stretching actively, which is also known as strengthening. When the spasticity is reduced, perform active stretch by strengthening the opposite muscle. For example, your finger is very spasticity, but because you do treatment, you do exercise by yourself, then the spasticity is start to reduce, and you're able to move it a little bit. At that time, strengthening need to come in. Strengthening need to come in. For example, you can use different type of the tools to help you strengthening. For the first one, you can see the first photo is called the adjustable wrist orthotic trainer. So once your spasticity is reduced, you can use it to strengthen your muscle. Okay, or you can put at the table and then actively move your wrist extension. Move your wrist up. It also can help you to do the active stretch for the wrist and finger muscle. And then third is strengthening with the TheraBand. With the TheraBand or rubber band also can. Okay, and this strengthening is not recommended to do when in very high spasticity. Why? In high spasticity stage, the patient is not able to move also. So that time is preferred to do passive stretch or prolonged stretch until the stage when the spasticity is reduced. Then you can start to come in with the strengthening exercise. Because strengthening exercise, during the spasticity stage, the patient maybe will do the compensate movement, which is maybe will cause the patient more tightening the muscle or more spasticity. So better need to reassess the stage of the stroke, then only prescribe the treatment. Okay, number 3. This is our Techcare machine. Okay, like just now I show you is the 3 type of stretching: passive stretch, prolonged stretch, and active stretch, which is called strengthening. Okay, these 3. Then how the rehab technology can help stroke patient? Okay, this is an air compression. Compression therapy can help to improve blood circulation, reduce muscle stiffness, swelling, and edema. Okay, this also is proven by one of the study. Why air compression can help hand for hand spasticity? Why the air compression can help? Okay, when you get stroke, how to say blood circulation will be reduced because muscle didn't contract. When stroke patient at the hand, okay, you can see they are a bit swelling and the skin is very dry. Why? Okay, because the muscle, they didn't contract it. Because they can't move. The patient cannot move their hand. So the muscle is very stiff. The blood circulation, it cannot pump by the muscle, go through our heart. So the hand will be edema, maybe will be swelling. That's why the air compression can come in to help those stroke patients to reduce the swelling and improve the blood circulation. Once the blood circulation improves, the muscle also have the nutrient. The muscle also easier to get recovered. Okay, then this air compression is suggested do 10 to 15 minutes per section, 2 times per day. But it's not recommended for patients with skin sensitive and open wound, because the air compression maybe will directly touch the wound and the patient will feel pain. That's why it's not recommended. Okay, you can see the second picture, which is the air compression for the leg. For the leg air compression, this one need to be careful, because for those have a heart problem, heart disease, when you put the air compression on your leg, air compression, it will push the blood go up to heart. If those have heart disease, this one is maybe a burden for them. They need to slowly to improve the blood circulation. So for those who has heart disease, the air compression for the leg may be one side first, then followed by another side. Or you can change the mode on the machine to maybe from the foot to the calf first, the type done first, like this, okay? Then another one is a hand robot. Okay, hand robot. How hand robot can help to treat stroke patient with the spasticity? Okay, hand robot training can help to improve early joint movement, motor function, and reduce muscle stiffness. Okay, you can see here got one. Everyone can see my video. You also can see my video. Okay, and you see. Okay, this is the hand robot. So we wear it. Then we can use the machine to passively move the finger. For those patients that have spasticity not so high, they can use this and then passively move their finger. It will help to reduce the spasticity as well as reduce the muscle stiffness. But this is not recommended for patients with high spasticity stage. Why? Because high spasticity stage, the finger is very tight, and then they're not able to open up the finger. Cannot wear it because we need to wear into the column inside. So for those high spasticity patients, they cannot wear it. It better go through like just now the passive stretch first, then slowly we'll use this for their treatment. And then this hand robot is suggested 10 to 15 minutes per section, 2 times per day, combined with active stretch. Okay, and then this hand robot also got a lot of function. For example, you can combine with functional movement. You can wear this hand robot machine, and then you can train to do like holding the water or holding the cup. It also can help. Okay, so for today, summarize for the today presentation. Early movement can help to reduce joint and muscle stiffness and spasticity. That I show you passive movement, stretching, and strengthening. Second, prevent improper passive range of movement exercise or using overhead exercise fully to avoid shoulder pain and subluxation of the shoulder. Okay, for those who patient who having spasticity, I need to see the stage, because improper passive movement of your shoulder, that means because your shoulder affected side is not able to lift up. If you passively move it too strong, maybe the shoulder will have shoulder pain and subluxation. So for the pulley, need to be careful those who have pulley at home. Third, caregiver cannot pull the patient affected hand strongly to avoid subluxation. For stroke patient, they have a weak shoulder joint. If you passively or strongly pull their hand, affected hand, maybe it will cause subluxation. Okay, and then for support the affected shoulder during resting. I just now previous the photo I show. And fifth, consult health professional when needed. When you get stroke, it's better to consult health professional, for example, physio, occupational therapist, or Chinese insect, also to get a better strategy to treat your stroke. Okay, today this is all my presentation, and thank you for today spend your time. I hope after today you all can get extra information or some knowledge, especially patients who joining our section today will get a bit of information how to treat their spasticity. Thank you.
Thank you, Yvonne. Thank you for the sharing. We get some question actually from the floor. The first question actually coming from Davy. Davy mentioned, maybe I'm not sure on the question. So Davy mentioned, may I know nighttime splint is advisable? Davy, you can turn on your mic. You can turn on your mic. Maybe you want to explain what do you mean by nighttime splint? Is it the duration needed for the nighttime?
Hi, hello.
Hello, David. Yeah.
Hi. I just want to know whether the nighttime splint is advisable or not, because my friend, not physiotherapist, they usually advise the patient to wear the splint for 4 hours maximum. So I just query that, is it advisable during nighttime also for 4 hours?
Okay, for my advisable, I got go through your question and then I got study some research and journal. For wearing splint at the night time, actually it didn't show any improvement for the patient. Okay, so it's advised wearing the splint during daytime. And then when you're wearing the splint at the nighttime, because the patient is sleeping, they don't know they're moving, or maybe the splint have a sharp at the edge, maybe it will injure the skin also. So it's advisable wearing at the daytime. For the 4 hours, wearing at the daytime will be better. Okay, another reason is why during daytime, maybe okay, I'm a stroke patient, I have a stroke, so I want to get something, I use this hand, but sometimes I'm very excited and very nervous when I want to get things. My spasticity will be increased. So it's better you wear splint at the daytime, even though you're very excited when doing something, you wearing the splint, it will avoid the spasticity to be increased. Okay, this is what my answer.
All right. Thank you. Thank you, Yvonne.
Thank you, Miss. Thank you.
Right. We have second question. Chloe mentioned, how about weight-bearing stretching for wrist extensor and bicep? This is coming from Physio, I believe.
Okay. Chloe. That means you want to use weight-bearing, and then stretching the wrist flexor, right? For this, I feel it's a good strategy to reduce spasticity, especially using their body weight. Okay. Why I say so is because you're using your body weight, the joint sense also improve. Okay, joint sense also improve. Proprioception also improve. When you're doing the weight bearing with stretch, and then the patient also comfortable, then it can improve the joint sense as well as reduce the spasticity. Is it this you mentioned? Right, okay.
Okay, thank you. And then the second question from Chloe is, may I know how is the mirror therapy that can be done by the robot? 15 to 30 minutes once daily? Do you want to share?
Okay, if you have this kind of robot, I think most of the clients, they get this right. Okay. Okay. For brain, if we have stroke in our brain, one side is destroyed. One side is destroyed. So our hand cannot move. Cannot move. How we use our exercise to make this our brain awake or make our brain connect to our muscle. This is through training. Training. Repeat and repeat doing the same movement. Repeat and repeat doing the same movement. It will stimulate more to our brain. So as long as you can, it's better put about 20 minutes. Repeat and do.
I can add on this. Sure. Thank you, Yvonne. I can add on this. For patient, we have a device from at home. We recommend to use like 2 to 3 times per day. Per session is 20 to 30 minutes. So it can be mirror trainings. It can be CPM trainings. It also can be combined with massage training at the same time. All right. And we have a question from one. Chloe, if we have not answered your question fully, you can open your mic. Let's say if anything. Sure. Thank you. I go through the next question. May I know this I think is a good question. I would like to know as well. So Yvonne, you mentioned about stretching on the wrist and the finger, right? And sometimes we may have elbow as well. So this question is actually, what is the differences to start from distal or proximal part of the spastic limb? Is it coming from the distal or proximal?
As I know, I treat patient and cooperate with doctor or senior physio and junior physio. For stroke patient, they come with hand and leg. Mostly they will focus leg first. After that, until hand, usually they will focus on shoulder. For my experience, I feel it's better start with shoulder first, then come to our finger. Why I say like that? Our muscle, we come back to our anatomy, our natural muscle attachment, insertion. The shoulder will come from where? Come from the clavicle to the elbow, right? So, and then elbow to our finger. If this one stable, then the elbow can move nicely. Okay.
All right. Thank you. We have another question from Chloe. Is there any research to show improvement of ARAT and Fugger-Mayo score? Is it good for total flexic stroke or high tone? I'm not sure. Is it mentioned about the robot?
You mean the robot? ARAT is a robot?
I'm not convenient to open my mic. No worry. No worry.
Okay.
So, the research currently, actually, robotics research have been done in the past 10 to 20 years. Shows repetitive training actually can help to improve the hand function. Whether it's good for total flexic stroke or high tone, Yvonne, maybe you want to answer on this?
Okay, I got one patient with flexic tone. He has a 7-month stroke with flexitone. Okay, with flexitone. We read this for 2 months. He now able to move a bit of the finger. So I think this is helpful for flexitone. Even though today our topic is hand spasticity, I feel this one is helpful for flexitone. Okay.
Okay. For your information, patient or caregiver who are not sure about what is flexic. Flexic is where there is no tone, not able to move, very soft. Yeah.
Very soft. It can't move and very soft.
Right. Great. Okay. Thanks. Thank you, Yvonne. I have more question. I get a question from more on for patient side first. Yeah. Margarita, we put your question next. The next question coming from the patient actually. Is it many ask question is like, how about more than a year, Yvonne? Do they have the chance to recover from spasticity or not? If they are over 1 year already?
For me, if the patient is not coma, still got the chance to recover. I feel like just now I show you the graph, the burn stone graph. You can see the stage. they have a lot of explanation about the stage of recovery, but I pick up one to explain the stage, okay? A lot of patients, they until stage 3, they will start to give up the treatment. We don't have any research proof to prove how long you can be recovered after you get stroke. This is depend on your brain and depend on the person, how persistent they do the exercise and to stimulate the brain. So I feel if 10 years is all right, as long as you are awake, you can walk, you can try.
Understand. So the answer is, if you are conscious, you can actually still improve the stroke spasticity as well, even after 1 year of stroke. All right, thank you, Yvonne. We have a question who raised hand, Lim Sui Hui. Maybe you can turn off your mic. Turn on your mic. You can ask your question directly. Lim Sui Hui, are you there?
I think should be given distal to proximal.
Anita, you can turn on your mic. You can turn on your mic. Anita, you can turn on your mic to ask your question. Yes.
Okay, in spasticity reduction, I think, okay, for muscle stimulation, normally we give distal to proximal using fast icing, isn't it? So to reduce the spasticity, we should give slow icing. So is that advisable to give from distal to proximal or distal? Not very sure about it.
Oh, okay. You mean hand, right? Not other part, right?
Yeah.
Okay, if hand,
any parts, hand or any muscles which is having spasticity.
okay. If hands for group patient, I prefer start from the distal. Okay, why? Our palm, our finger is more sensitive compared to our forearm. Right? If you stroke forearm, your either is in the front area or the dorsal area. So we need to see if you want to for hand, I better put distal to proximal, distal to proximal. Okay, is it I answer your question, Anita?
Distal to proximal to reduce spasticity, is it?
Yes.
Okay, thank you.
We have, all right, thank you. Anita, I think there's two speakers there, so maybe there's an encore. Right, we have a Connie Lee. Maybe you want, you can open your mic and you ask the question directly. Connie? If no, then I will move on to the next one. Karen Chu. Hi, Karen Chu. You put the raise hand button, do you? Or accidentally? Or if not, we move. Oh, sorry, just a second. No worry. All right, I move on to the next question. Patient or caregiver, if you have any question, you can feel free to stick here. I have a second question here. Whether FES can reduce spasticity. This is coming from an OT. FES is, for information, is functional electric stimulation for patients who may not know. Yeah, Yvonne, what do you think? Can FES reduce spasticity or not?
Can, but not for the high spasticity stage. Not for high spasticity stage. It's usually for the spasticity is under like stage 2 or stage 3. Then okay. Okay. Actually, no one treatment can cure a patient. This is why I say no one treatment can cure a patient. So it's better combined with like passive stretch. Then with the exercise, what you can do at home. And this is the good strategy for a stroke patient. Okay. Today, actually, why we share this is someone now MCO. A lot of patients, they also worried and scared to go physio center. Okay, why not we change a strategy? For example, you ask patient to get this, then you have a passive stretching, and then 1 week once or 2 weeks once, maybe it will helpful. Because you want to travel from one place to another place, is it the patient not tired, also tired? So this because it's a stroke, it's not a MS case, not a musculoskeletal case. So with stroke patient, they better one consult. Of course, we need to have a consultant like physiotherapist or occupational therapist. With them, then with the help with the machine, they can do at home. Somehow this is very suitable for the current situation. This is why the purpose why we're sharing for this session.
Thank you, Yvonne. The next question is Handsplint. This is coming from a patient. What is the most effective way to use the Handsplint?
Okay, Handsplint got different type of Handsplint. Like just now the slide I showed got 4 type already. You need to check. You need to ask your physio or ask your occupation to check whether you are under category which one. Maybe synergy for our fraction or extension. Then you choose your spring. You cannot choose by yourself. If you very understand what is stroke, then you can get the spring. The spring got a lot of type, got fraction, and then you put the spring. With this one suitable for those who have the fraction synergy. So this one is better consult your professional people.
Yvonne, okay, thank you. Another question is, does the robot suitable for CP teenagers or not? Coming
CP.
from, yeah.
CP case depend on what type of CP case. It's very serious and not advisable.
Understand. So I checked this question is in Q&A session. The box, you can actually explain if you have any question. You can turn on your mic. All right. I move on to the next one. So Ivona, for what we have a question from a patient as well. How to let patient to regain their confidence to use back the affective side of the body. This is more on the psychology side. So how can we help the patient to regain their confidence? Do you have any idea or suggestion for the caregiver?
Confidence for patients who have stroke, they cannot achieve like the movement as previous. It's better the physio or the family member to give the exercise or the treatment he can achieve. For example, like the stroke patient who only have wrist, the elbow can do. So you can combine the elbow exercise for him, then he can achieve, then he also happy. He will gain the confidence. Another one, he feel he's a weird person in the family. Maybe need to talk more with them, don't let them alone, and try to bring this patient to the Stroke Association Center, which is same because all is a stroke. So they inside they won't feel they are weird because only them. They got a lot of patients also have stroke. So after they see, they will feel more confidence.
Okay, thank you, Yvonne. The next one coming from the patient, is it possible to achieve fine motor recovery?
Yes.
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 Wow.
Last year I got stroke patient with a very new one, very fresh one. I used 3 months to able to do the fine movement thing. For example, like drawing, writing, and then use the string to go into the stone also can. So it's possible. It's possible.
What is the tips that patient can use? I mean, let's say to achieve that fine motor skill. Any training that normally you may use or you think is very practical for the patient to train?
I feel it's functional.
Functional.
Functional, I feel is very advantage for stroke patient for fine movement.
Maybe you give a few examples.
Fine movement, for example, like you can ask them do something on the table. Okay, but of course you need to combine with stretching. After stretch, ask them to do like pick up a thing to this side and that side. Also can. This is the example.
Understand. Okay. So how about how to improve? This is also another question from patient. How can they improve their hand function? I mean, yeah. Do you have any suggestion?
Actually, improve hand function, we also need to assess the patient in which category, in which stage, in which stage. For example, for those just happen stroke, just a bit of spasticity, they want positioning very important. So keep on doing positioning and try to do some, because just happened, so you can do some mirror therapy, see it can move or not, to stimulate the brain also can. So if for those it's already long years, maybe 10 years, 10 years of the hand spasticity, what you do? What you should do? You do this. You keep on stretch for 10 years already, still can't. Do you still want to do stretching? Don't want. Maybe you can change another strategy, for example, eye stroking. Maybe you can do some mobilize, let it soft a bit, then or soak into the ice water and then see how the reflex of the hand, maybe like this you can help to treat those patients who have 10 years spasticity. This is depend on the therapist's creativity, how to use the theory and apply in treatment.
Understand. Well, that's a good tip. How about what is the do and don't for the patient? Do you think while they are doing physio? I think you show in some of your slides. Maybe you want to add more. Anything else you want to give suggestion or advice for the patient?
For a lot of studies say that, not say fully lah, we can say excessive passive movement. For those we like to do passive movement, for those stroke patients, we need to be careful because like we can see the synergic pattern usually is at where? Elbow, scapula, wrist. Then how about the shoulder joint? Is it got spasticity on the shoulder joint? So this one is a big part. When we do passive movement too over the range, it may occur sublux. Stroke patients usually have shoulder pain. It's normal for them. Shoulder pain means the shoulder joint is abnormal. If we do passively over the range, it may be cause sublux. So this is need to be careful because I can see my patient come to me say, "Hey, I got buy the pulley at home." How you do? You really use your affected hand to pull, or you use the good hand to pull. If you use a good hand to pull, that means very dangerous. You need to be careful. Don't too overstretch. Like this. This is pulling. Another one is a lot of stroke patients like to go massage. They will. We didn't say massage is not good. Massage is good. Massage is good, but massage is one treatment. Massage is just reduce the spasticity. It's just one of the treatment of all treatment to reduce spasticity. But if the massage too pain, more pain, what you will do? You will contract. You will more spasticity. So massage is need to be very careful. Okay, and then if those massages reduce spasticity, but how about the functional movement? Movement is need to use brain. We need to use our strength. So the massages won't help the movement happen. It's better you need to do yourself. Okay.
Understand. Thank you, Yvonne. We have another question from Physio just now. What do you think about PNF stretching instead of traditional passive stretching that we usually do? Which one would you prefer?
PNF stretching instead of traditional passive stretching. Okay, come back to, okay, this one is a bit deep. Okay, this is a bit more technical now. Spasticity. You faster do the muscle stretching. If I want to stretch the bicep, If I very fast, my response is contract. So you need to do slow. Slowest the stretching, reduce the spasticity. Okay. So your question is PNF stretching, and traditional passive stretching. You need to see the patient. If the patient have joint deformity, For example, you stretch until here, the joint cannot let you to stretch already. You want to use traditional passive stretching, traditional, you keep on press, maybe you will cause a muscle tear. You will cause a muscle tear or bone may be injured. So it's better use the PNF stretch. This is need to see the patient condition. Okay, if the patient is cannot full range, it's better use PNF.
Sorry, Yvonne, sorry to interrupt. I mean, coming from a patient point of view, maybe you want to explain what is PNF stretching in very simple terms. What is examples of PNF stretching that you mentioned?
PNF stretching is a lot. PNF inside got a lot of stretching. One is like you need to hold relax. How to hold relax? I need to stretch a bicep. I will hold here and then stretch until certain level. It cannot go already. And that range you need to hold for maybe 7 seconds, 8 seconds. Okay, follow the theory. You need to hold like 8 seconds. And then you stretch again. The new range.
Understand.
Okay, this is called PNF. This is very technician. Usually patient won't do. It's better let the therapist do for patient.
Okay, great. And one more thing, let's say, for example, we have a patient ask about, my husband has subluxation on his shoulder. What is the exercise for the patient for this condition?
Subluxation is need to see how serious is it. If very serious, you better don't do shoulder movement because easier to dislocate.
So it means better to rest, is it?
Better to rest or support. You can, in Lazada, you can buy the supported shoulder, raise and then wear it, or you need to go to orthopedic to do surgery, to hang it up, to avoid any complication.
Understand. How about let's say, Yvonne, you mentioned, let's say if we just maintain our spasticity, we did not resolve it, let's say as a patient, we just keep it like that. And you mentioned it may develop to contracture. Let's say if a patient in contracture, what is your advice, let's say if maybe having some years already and develop into contracture, what is your advice for patient like having this condition?
Contracture is very hard to do by their family member. So contracture is better like use like cold, or maybe you need to slow stretch, or need to do like electric stimulation to loosen the muscle tight. And because how to loosen muscle tight? Because electric stimulation help to improve blood circulation. Once the blood circulation is improved, the muscle will be loosened because it's warm. When you warm, the soft tissue will be soft, so easier to do stretching. This is need to do combination treatment. You can't just single treatment. Okay.
So doesn't mean means not necessarily have to go to surgery. So what is it?
Need to see the joint. If the joint is deformed, yes.
Understand. So it still really depends on the condition, and we need to get advice from the health professional.
Yeah.
Understand. So how can we differentiate between spasticity and contracture? Let's say, I'm not sure, am I in a spasticity or contracture stage?
Contracture usually happen in joint.
Means I cannot open the joint.
Maybe you see the joint, maybe it's deformed, this one is a bit down. So this is contraction at the joint, spasticity at the muscle.
Understand.
Muscle is like this, but my joint is healthy. So that one you can treat spasticity only. For those have spasticity with joint contracture, you can see the bone here is abnormal.
The bone here will be how normal is it?
Like I bend like this, maybe the bone is out of alignment. The one is contracture.
Great. We have three more minutes left here. Anyone have a last question if you would like to ask? On the floor. If a PD develop wrist contracture following spasticity, can we perform joint mobilization? That's the first question. Second question is, does Botox injection really help in reducing spasticity? I think this is the last question. All right, Yvonne, 3 minutes. First
Okay.
question, yeah.
If the patient develops wrist contracture following spasticity, can we perform joint lock? You need to, okay, if the wrist contracture is very serious, you cannot do joint lock because it's already stuck. For me, I will treat the muscle first, okay? Then the joint need to depend on how severity. If the joint still got the joint gap, so I will do joint lock. Okay, so depend on the condition. For the last, does Botox injection really help in reducing the spasticity? My answer is yes, but is short term. In short term, for long term, after Botox, also need to go to stretching, prolonged stretching, then it will help. Okay.
All right. Thank you very much, Yvonne. So you means, yeah, I want to ask question in case patient have, we have 2 more minutes. So I will take this question. I want to ask question in case patient shoulder sublux one finger and complain pain. Other than shoulder support and rest that shoulder, any treatment or management to reduce subluxation?
Yes, how to, okay, this type of case you need to think, what treatment can help to let the muscle contract? We got one treatment called proprioception, right? Proprioception how? Joint sense. When you stimulate the joint sense, the muscle will contract. What you need to do means weight bearing, keep on weight bearing, let the muscle to contract, then slowly bring the joint gap together. Bring the shoulder joint muscle and the joint bone and bone together. This is you can do. You can do proprioception or weight bearing exercise for this.
All right. Thank you, Yvonne. I think our time is we have one minute left, so I will wrap up the session. Thank you, Chloe. Actually answering one of the questions. Wrist contracture can start with some gentle joint mobilization with muscle stretching. All right. Thank you, Chloe. And I hope all of you benefited from this session. And if anything we can improve, we will share your feedback form. Feel free to fill up with us, and then so that we can improve for the next webinar. If any question, we can keep in touch in email. Thank you very much for all the time today, and see you next time. Thank you.
Thank you.